That was a little dramatic. I feel like it's so cliche. Usually patients don't immediately become unconscious. Hey guys, my name is Jamie and I'm an emergency medicine physician in New York City. And today I'm going to be reacting to The Good Doctor Season 1, Episode 1.
I want to have a clean cloth. Please, someone.
I have a fresh change of clothes in my bag.
That's great.
So it looks like he had some injury from the glass, like broken glass, and fell to the ground. Usually patients don't immediately become unconscious like that unless there's like some big head injury, or maybe he just passed out because it was a scary experience for him. I know this is like not hospital situation. This is kind of like what happens out in the field. Anytime there's a traumatic injury like this, you want to make sure that no further trauma is happening for the patient. So it's usually a good idea to kind of clear the area. The usual trauma algorithm is airway, breathing, circulation. They're kind of addressing the breathing portion of it by not pressing on the trachea. And then if you keep going down, A, B, C, D, E, E is exposed. You want to expose and make sure there's no other injuries there. So it looks like they're about to kind of take a look. There's a big piece of glass, of course.
Some glass. He'll be fine.
Who are you?
Hello, I'm Dr. Shaun Murphy. I'm a surgical resident at San Jose St. Bonaventure Hospital.
He's a surgical resident. Looks like he's traveling and got to see a child who got injured and is now intervening and helping with the other doctor.
Autism, a mental condition characterized by difficulty in communicating and using language and abstract concepts. That's the definition. Does it sound like I'm describing a surgeon? You're hiring him to be a surgical resident, my department over my objections.
This is a very unusual way to hire a resident. Usually, residents are matched with a residency program through a match system. It's like a big algorithm where the fourth year medical students make a list of programs that they like after interviewing, and then programs make a list of candidates that they liked, and then there's like an algorithm magic happens, and then the system matches you with the program.
Hey,
Sorry, you seen Claire?
would you turn off the light?
Sure, you seen Claire?
Why? Would you turn off the light?
Melendez wants to operate on 104, but Claire hasn't gotten informed consent, and she's ignoring her page.
I don't know that a lot of residents would be like topless and sleeping in the call room. Mostly people sleep in their scrubs. Oh, I see why he's topless. I feel like it's so like cliche, like it's not a medical drama without some like call room action.
The veins in the boy's left arm are popping.
Is that bad?
I don't see.
Intrathoracic pressure.
No, his chest is rising.
I'm thinking that he's probably gonna talk about maybe tension pneumothorax, saying that there's increased pressure on one side of his chest. So now he's setting up a makeshift chest tube, it looks like, and they're gonna use alcohol to clean the skin. Full disclosure, I don't know how effective that is. I mean, presumably alcohol kills the germs. He got some gloves. Don't like when people do that. Why? Setting up a chest tube system here. So basically in tension pneumothorax, you're getting increased pressure on one side of the chest because there's air going in from whatever trauma that he had, in his case, glass. So it compresses all the structures in the chest area. So your heart, your vessels, your lungs, and it can basically become really dangerous. It can stop your heart, you can't breathe. Or usually we look for tracheal deviation. Any kind of penetrating chest trauma with those signs, you're gonna need a chest tube, which is what he's setting up. Ideally, this is done in obviously a hospital setting, but it looks like no one has come from the ambulance, so they're just gonna do it out on the field.
It should take place 2 ribs down.
And I always find it very interesting in the TV dramas. Usually the patients are just like unconscious, and you have to question like, why is this person so unconscious? But it's not very different. The way he's doing the chest tube is not very different than the way we would normally do chest tubes. We really just feel the landmarks, put a scalpel, cut, put your finger in, clean with a clean glove, feel the inside of the rib, and then you put in the tube. Like, it's very like mechanical. You cut and you put the tube in. Now there's air coming out.
Why the bottle?
The air will continue to leak and accumulate until the damage can be properly repaired. The tube allows the air to get out. The water in the bottle stops the air from coming back in.
A homemade one-way valve. He's breathing. You saved his life. He saved his life.
He doesn't want to be touched.
It changed. The boy's ECG changed.
It's the same. 86 BPM.
No, it used to be higher.
No, it used to be 86. It's still 86.
It used to come up to here. Lower amplitude means lower voltage. Lower amplitude means lower voltage.
What's going on? What does it mean?
I think what he's trying to get at is maybe there's lower amplitude because there is something impeding the electrical signals from the heart to getting to the electrode. So whether that is fluid, probably most likely in this case, meaning there's like fluid around the heart. Often we don't make big deal of the amplitude of the EKG unless it's very big and they have enlarged ventricles or enlarged heart, or if it's alternating, often that means there's fluid around the heart and the heart is bouncing back and forth, so there's alternating amplitude. That's usually a bad sign. But just isolated little bit of an amplitude, that's a really subtle change to pick up on.
I'm set up in trauma 3 with an EKG, full blood work, and a PAM scan.
You need an echocardiogram?
Who is this guy?
So he is pushing for an echocardiogram, which is an ultrasound of the heart, because it'll tell you right away if there's fluid around the heart.
You asked earlier about an echo. You had no medical reason, but you asked anyway. Why?
There was this weird guy, the one that did the one-way valve. He kept insisting that the boy needed an echocardiogram.
You didn't say why.
He was really weird. His blood pressure's dropping. That makes no sense. He's not bleeding anymore. Everything's under control.
Do an echo.
Sir, the boy's wide open. It's gonna take a while.
Good. That'll give me time to figure out why the hell we're doing an echo. Dr. Brown, you're with me.
I mean, honestly, an echo, if you have the ultrasound ready, will take 2 minutes if you're looking for fluid around the heart. For any more advanced, like cardiac function, and obviously those will take longer. Sometimes you just put the probe on, you can see like right away that there's fluid around the heart.
I understand you think he needs an echocardiogram. We just don't know why.
Well, I noticed that there was a slight reduction in the intensity of the electrocardiogram.
The electrical flow, I noticed that too. The heart rate was the same, but the amplitude dropped.
Pericardial effusion.
Reduced cardiac output,
Would stress other organs.
causing them to shut down.
Yes.
They did the echo. It's normal. No pericardial effusion.
No, it has to be. There is no other explanation.
The echo is normal.
Interesting.
Show them.
So that's those are the 4 chambers of the heart. You can get it by placing the probe kind of on the side, and you can visualize, and it's a good way to see if one chamber is bigger than the other, or if the valves are working properly.
This kid was sprayed with glass shards, cut his jugular. What if a piece of glass entered his bloodstream? It could have traveled down the jugular vein, into the brachiocephalic vein, and onto the superior vena cava. If it punctured the SVC, the blood could be leaking behind the heart, restricting the heart's ability to expand and fill during diastole, reducing the heart's efficiency.
Lord of ifs there.
That would be very rare. The heart it's a 3D structure. So when you do a 2D view with an ultrasound, there are certain parts that are difficult to see. So that's the part that she's talking about.
Dr. Brown?
Oh, and they found the glass.
You were right.
So that's the end of the first episode of Good Doctor. Really unusual but interesting case. I learned that something like that could potentially happen, which was interesting. Hope you guys enjoyed the video. Let me know what you guys think about The Good Doctor. I know it's a show that's been around for a long time. Let me know what you guys think, and I'll see you guys in the next video. Bye.